All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. I was listening to some songs as well. I love this ghazal and I forgot to turn it off. So hope everyone is doing well. My apologies for this morning that I did not show up, and neither did I say that I will not show up. So I had all the plans to show up, and I think the day before I was, because of the second shot, I was a little tired and fatigued and I didn't sleep well. So last night when I slept, I just slept like a baby. So I woke up 8:30 and I thought for a second to say, okay, I need to go do my lecture. And I decided, you know what, I'm just going to go back to sleep. And I slept again. So that was just my laziness that I slept again. Thank you very much for so many cool beans who became concerned. Somebody said that anti-vaxxers are saying Dr. Bean is knocked down. And then some folks were genuinely asking that, hey, where is Mubin? So thank you very much for your concern, for your love. I did post it then a little later when I realized that I've caused a slight minor panic. So I then posted it. So thank you very much. Thank you for love, for your care. And here I am. So I am all fine. So tomorrow, if tomorrow something happens, don't bring this one up that Mubin was doing this. But generally, I'm fine. Denise says, I saw your tweet and knew you were all right. Thank you very much. I tweeted Luffy and Kyrie. I actually made a video of Luffy today. He was trying to pluck at the plants upstairs in my bedroom. I thought my wife would enjoy that. So Lizzie says, you needed the rest. Thank you very much. Our patron forever. Guinea bean lives. Yes, yes, it lives so far. So Guinea bean lives so far and does this, and tomorrow we'll find out what happens. There may be some anti-vaxxer beans who have fingers crossed. Blues lover says, grateful you're healthy. I'm sure you will be in a great health. Thank you very much. I think I'll be okay. GGNN says, thank you for the super chat. Dr. My 10-year-old nephew got COVID. Can he take Iver, and what other meds are recommended? So I cannot give you a specific advice, but I'm going to tell you how Iver has been used. Ivermectin has been used primarily in children. In countries, some countries, it is the children who get worms more than the adults. And so ivermectin has been used in them. 15 kilogram body weight and above are allowed to have ivermectin. 2 years of age and above are allowed to have ivermectin. And the ivermectin's dose is 0.15 to 0.15 to 0.2 milligram per kilogram body weight. That is the therapeutic dose that is supposed to be given once or in 3 months, once in 3 months, once in 6 months or a year. However, as you can see, FLCCC has been using it. I have been using it for my patients for prophylaxis on weekly basis, for management on daily basis, and for FLCCC has been giving higher doses. So generally, children can take ivermectin. The unknown is still the same, that for children or for adults, we actually do not know that when you keep giving oral ivermectin on daily basis, what can happen. So I guess with this vast use of ivermectin nowadays, there will be more data that will be collected, but this is the unknown part. Okay, so Kahina Lauren says, ivermectin is way more proven for children than these new vaccines for decades. So without comparing it to vaccine, yes, ivermectin has been used for children a lot more than adults. Abdul Rahman says, I got my first dose and I have pain in head. Sorry about that. Which vaccine did you get? Denise says, yep, that's what my infectious disease doctor told me, primarily kids. Correct. Julieta says, how can we avail of ivermectin for prophylaxis? We have no prescription to show. Thank you, sir. So Julieta, I'm going to share my screen, and I have now used um, FLCCC a lot for doing this. So thanks to them that they have put this protocol up and the list of doctors up. I think existence.com also has it. So Julieta, if you go here to flccc.net, under this big red button, there is how to get ivermectin. And if you click on that, there is this list of doctors that in the US prescribe ivermectin. There is existence.com. So let's see if I can, they used to have the link to them here. Let's see, directory of doctors prescribing. I think this is the existence.com. And here, if you see, they also have a list of doctors or a directory. And this includes international countries as in other countries as well. So for example, Afghanistan, Argentina, Australia, Bangladesh, Belize. I'm surprised that there is only Dr. Alam. I'm sure there are going to be more. Belize, Bermuda, Bolivia, and so on. So you can actually ask them for ivermectin. I think the part that is missing here is UK. And I still cannot imagine why Canada cannot figure it out. What happened to Canada that they don't do it? So Canada here, BC, CDC, Alberta Health Services, ivermectin not recommended for COVID-19 outside of approved clinical trials. And this is just, all of a sudden, doctors have forgotten how to work. Ivermectin is pretty safe. It is safer than Tylenol. So hopefully this list would help you, Julieta. Faizan Ahmed says, question, how many years we can expect this pandemic to end? I'm a little concerned about Indian variants thoughts. So yes, of course, today UK declared Indian variant as the variant of concern. And it will be very, very interesting to see. I hope there is not much damage. It will be very interesting to see that a country that has taken vaccine in a larger scale, at a larger scale, and have brought the infection down to almost none or to a very low level, how would they fare with this this pathogen, this variant? If you ask me for my conjecture, I think they will be fine. If you ask me my unknown, what I do not know is that the antibodies, how much is the escape from the antibodies from vaccine or from actual infection? So that is what we would find out. And of course, this variant is here in the Bay Area as well, in here in the Silicon Valley too. So there were some folks who are getting sick with this over here as well. So to your basic question, how many years? Look, I very strongly believe in this, and I still believe in this. For the US, it is just maybe another month or two. That's it. If you look at the US's situation, if we go to Worldometer and US, so 33 million coronavirus cases. And then what is that 33 million to the percentage of US population, which is 330 million? Is it 10%? So here, and it is still going, I hope it stops soon. So here, US is still, look, it's a significant number, 47,000, 49,000. Yes, in graph, it looks lower, but it still is a large number. So US is still going through this. I think that we would be out of this very soon. And if you look at our vaccination, go to Bloomberg. The only country I'm upset with is China, and not because of the Wuhan. So let's say that was an accident. No data from there. There should have been data. If they are doing well, then their data should have helped the world. And if they're not doing well, then we should know as well to see what is going on. Okay, so here, and I have many Chinese friends. So this is not about China or being upset about China. It's just the behavioral part. So that must be the authorities part. So here, if we look at US, I want to see it in this table. So US is 45% one dose, 33% second dose. I believe that, like Israel, once we reach 55% first dose and then about 40-45% second dose, that is where you would start seeing even more drastic reduction. Now, we'll see if more people continue to get the vaccine or not, but I think we are about to get out of it. So to once again, Faizan, to answer your question, I can talk about US because this is something which I know more, that we'll be getting out of it soon. If you look at Israel, I think Israel can claim that they are out of it. They still have to be careful now with the other variants from coming in, but Israel can say that, hey, we are done. Look, they're done. Israel can say they're done. I think UK can say they are done as well, although they have a new variant as well. Their vaccine is still, they have to catch up with the second dose, but it is still a very low number compared to where they were at. So there are countries that are saying that we are done. So Faizan, to your question, I think the answer depends upon the community in which you are and the trend there and behavior there and the vaccination there and the medication used there. All of those together would tell what would happen. What worries me is this. So let's say one country does all the hard work to eradicate it from their population. Now, if another country is not that responsible, what will happen with the people's interaction? So I believe that more stricter, stringent mechanisms to make sure that somebody who's coming in from a country which may not be that careful, how do we make sure that they are healthy? Okay. So then Westfield says UK is just looking for any reason to keep their public scared and from opening up, in my opinion. I think they are pretty good at this time to continue to open up. Kevin BR says, is Ivermectin showing efficacy in India and is it improving symptoms of dizziness and long haul COVID? Do you know how Mexico is doing with COVID and Ivermectin? So very good question. So Mexico, of course, is doing well. For India, it is a mixed bag. It is such a large population that generalizing it that ivermectin is working there. Even folks from India reach out to me and say, is it working? And then folks from India reach out to me and say, I am using it and it is working. And folks from India reach out to me and say, what are you guys talking about? What is this ivermectin you're talking about? So I think there are all kinds of groups there. This is why those who have been with me for about a year now, I have always been saying that this is the responsibility of the medical leadership. That is FDA, CDCs, WHOs. These are the leadership organizations. They can get the word out that can spill into the whole world, that can seep into the whole world. These organizations are causing damage by giving incorrect, opposing the incorrect, not just incorrect, opposing messages, which reduces the usage even more. So if these organizations were on a better foot, we would have done better. Even then, I would give credit to India that India has, I was looking at many of their protocols now. Many of their protocols now include ivermectin. We'll see how the results are in another few weeks and months, but they have started using it. Now, symptoms of, I want to address this as well. You would like this. So I've been talking about my mother-in-law, her family who became sick, were sick for a few days, started ivermectin, they became better. My mother-in-law was complaining of loss of smell and taste. And so since I started with the high dose, relatively high dose, 0.3 to 0.4 milligram per kilogram, within 2 days, her sense of smell is back. So today she was telling me that, hey, I ate fruit and I could taste it, and I ate this and I could taste it. So it is within 2 days, that is back. So within 24 hours, the cough and those other symptoms gone. And then within 48 hours, she is able to start smelling and tasting again. Remember, we have talked about it, that taste is dependent upon the smell. So it is really not the taste that goes bad in these patients. It is the sense of smell that goes bad. And then the flavor, which includes smell, when that goes bad, the patient thinks my taste is gone. So that means her sense of smell is coming back. So that is excellent. So this is about the ivermectin and its efficacy. Faith and Grace says, number one, thank you for the super chat. The relationship between COVID and serotonin may be one of the reasons why NSE is useful for treating COVID symptoms. NSE is a serotonin reuptake inhibitor. Your thoughts? Absolutely, and we have talked about it before as well. NSE has one more action too, because it is part of the, it is one of those substances that can actually help break the bonds too. Plus, it is an antioxidant as well. It has multiple benefits. The only thing is, I do not recommend it in high doses, which some folks have been trying to do. That is not right. But NSE, take it in normal doses, maybe a little more than the normal dose, and it works very well. And if you're going to take higher doses, then with the doctor's approval. Denise says, my entire Delhi family, I had gotten Ivermectin months back. Oh, so Denise, you have family in Delhi? Very nice. And they are okay and they're protected. So Liza, first of all, thank you very much for the paper that I discussed in the lecture before. This vaccine are like the vaccine the military gave in case of an anthrax attack. The vaccine buys you time, but do not promise doctors could save you. This is helping as well. So there is an efficacy that is known. All right, so let's see. Lena B says, are you aware that Pfizer is in the process of developing a drug that will bind with the spike protein? Maybe it is similar to... So I actually tweeted about that. Both Merck and Pfizer. Merck has molnupiravir that says that, hey, it is a RDRP disruptor, and Ivermectin is. And now Pfizer is making a drug which they have started doing tests on humans as well. And here is the chime for dinner. So I'll just wait for it to go away. So Pfizer has it as well, and the drug is also a similar disruptor. So you take Ivermectin, remove 4 of its mechanisms, and what is left are these 2 drugs. And you don't have to remove them, just repackage Ivermectin in a different way, and now you've got a new drug. This is just so weird world at this time. Westfield says, my thanks to you doing a show both on the morning and evening of your second vax day. Great knowing you really are the superhero we knew you were. Thank you very much. I did skip this morning, but I'll be back from Monday. But thank you very much. The reason I would explain it once more, that I actually never set out to become a leader or to become a protector or savior or hero or anything, really. Believe me, when I started, it was that paper that I saw, and I said, somebody sent it to me, that paper which said do this, this, and this to protect from COVID, and all was garbage. And I said, man, this paper is going to kill people. I should talk about it. And that is how I started talking about it. The very first video that I did, both Facebook and YouTube took it down. So then I reached out to them and I said, this paper is actually dangerous. I'm trying to talk about something that would protect. Facebook reinstated it. I think YouTube did not. So eventually I just left it on Facebook. That is how I started. So I'm happy that we have come so far. But when I started, I could not think of doing all this. Colin Hammill says, do you see the distinction between how ivermectin works medically as opposed to how it works politically? Question Zimbabwe is a prime example. Of course. So this is not new now. The efficacy, the use of ivermectin and the benefit of it is not new now. It is known to so many doctors now. I had tweeted with the ivermectin about my family to say that, hey, I'm glad that I used it and I was not waiting for some big RCT. Guys, we are doctors. We know here are a drug. For example, there's a drug for pain. We know we can use it for pain. Similarly, here is a drug which has given you the mechanisms. Those mechanisms are shown. If those mechanisms are possible, then try to use it. Now, RCTs are really important when you have something really toxic. For example, let's say you have no idea how the vaccine is going to go. RCT is good to do. But if you take a vaccine from 50 years ago and say, I want to do another RCT on it, then one would look stupid doing that. This drug has been out there for 50 years. At least we know it is safe. So imagine you say, you know what, I don't believe it is useful for COVID. Fine. At least you should believe that it is safe, more safe than Tylenol. So if just somebody took it, it would not harm them. So, okay, fine, let them take this placebo. But get out of the way, let them take it. That is a basic problem. So, Colin, yes, your point is correct. And we are still hampered by these folks. And then I find this really weird that on one end, I talk about ivermectin. I think we have now more than 20 talks about ivermectin, mechanisms, trials. And then come folks who do not like, my friends who do not like vaccines. And then they come in and say, well, you know about ivermectin, why are you taking vaccines? And all of a sudden, some switch turns off, and now they cannot even believe in my message about ivermectin. This is just not right. Ivermectin has its own benefit, and that is presented to you, and that has its own merit. If there is vaccine and it has its benefit and that is presented to you, that has its own merit. Let people make their own decisions instead of just yelling and screaming. And I look at comments, and to one comment today, I said, dude, you got to learn how to bring your point across instead of just yelling, screaming, and cursing. Cursing does not bring the point across. It actually closes down the other person and says, you know what, I'm not listening. It is how you talk to the other person brings the point across. So if you really want to convince someone, then you do that. So anyways, it is weird that on one hand, I am the first one in the US to start talking about ivermectin. So designed by Teresa. Question, why is my white blood count spiked 1 year after I recovered from COVID-19? So that would be an interesting connection. If you want me to make the connection, I can make that connection. But generally, the answer should be, I don't know, because there is no known data that COVID patients after a year would develop increased WBC count. Now, if I wanted to make a connection, that will be, imagine you got re-exposed to the COVID infection. So somebody you come in contact with, they had COVID, you got it, your body decided, hey, I know this antigen, I have memory cells for this, wake them up, ask them to make antibodies, proliferate them. Proliferate means make copies of them, and let's work with them. So all of a sudden, your body went into that drive to start making more cells so that it can attack the antigen. So without you knowing it, body is now defending you. So during that process, WBC count can go up. But there are tons of more reasons for WBC count to go up. I'm just trying to connect it to COVID because that is how you ask the question. There are other reasons as well. Kevin says, is COVID gut a thing? Constipation, and can ivermectin treat this? So yes, COVID gut a thing. COVID actually can cause gastroenteritis. And whenever I talk with these things, some folks just make strange scientific comments. So somebody made this comment that because it has spike proteins and it has an envelope, it would be destroyed in the stomach, and then the broken pieces would go in the gut, and those pieces are going to cause the spikes, and those spikes are going to cause the vascular. And I have been saying it for a year now. Coronavirus has spike proteins on it. These act as a protective mechanism for it to escape stomach acids. It's almost like going 360 or going back to the square one. This is where I started this discussion, that paper from Stanford, fake Stanford, had written that if you sip the coronavirus towards your stomach, then it would be destroyed by the acids and you're fine. And I had to to come back and say, no, coronaviruses are not destroyed by the stomach acids, and they can then go in the GIT. They can cause gastritis, that is stomach pain, and then the intestinal inflammation as well. So gastroenteritis can occur. So Kevin, gastroenteritis is possible. How would your body react to that? Everybody's going to react differently. Some people would have diarrhea, some would have nausea, vomiting. Constipation is less seen, but maybe you have superimposed IBS-like things as well. Now, can ivermectin help? Yes. The only difference is that for ivermectin to be taken for GIT symptoms, one should take it on empty stomach, so it does not get mixed with the fats from the food and get absorbed. We want more of it to stay in the GIT and pass through the GIT so the GIT cells can pick it up and use it. So just take it on empty stomach and this would help. So Aja Broderson says, is there any data yet on if vaccinated people with breakthrough infections experience long COVID or not? So Aja, very, very interesting question, because this question has a baseline implication that has to be said to be yes, and that is vaccinated people would have breakthrough. So the vaccinated people, almost 1 billion people have been vaccinated, and the breakthrough has been really, really low, in hundreds. And that may not be a vaccine's failure, that could be an immune system issue as well. So first answer, that it is not necessary that vaccinated people would have breakthroughs. Then the numbers that are reported in breakthroughs that are so low that we do not even know yet. Vaccines are relatively newer things, right? We started somewhere in December, and now here we are. So if, let's say, today vaccine fails on me and I get COVID and I then become long hauler, I would know that in 2-3 months. Good way to phrase the question. It had a basic implication in it. Abdullah Musa says, do you think ivermectin will ever become passed off for standard of care for COVID treatment? I think it would never be passed by the bigger organizations. WHO may have a chance to do it because they still need to be more neutral for the whole world. I think in the US it is not going to happen. However, I think as more and more voices are appearing and more anecdotes of its usage and benefit are appearing, doctors are becoming a little bit more brave to be able to use them, as more doctors understand that, hey, I can use it off label. And unfortunately, this is unfortunate, but I think it is a good thing. I am an American, so what I'm going to say is some people are going to become mad about it. Unfortunately, there were people all around the world who were following FDA. I remember when I was doing medicine, everything will be FDA. What did FDA say? Even in the beginning of this pandemic, when I was trying to talk with my friends in other countries and said, use hydroxy, they would say, your FDA does not approve of it. So thank God for this pandemic that now people are realizing that FDA may not be saying all the things correctly. It is bad that my country's FDA, that was respected so much in the whole world, is now not respected that much. But I think it is good for humanity at this time, which is in crisis and needs this help. So I think people would continue to use them. People will find ways to protect themselves, and ivermectin is going to help. So Texas Meg says, thank you very much for the super chat. Thank you, Dr. Bean. Can someone anticipate myocarditis problems with the second vax by intervention, pre-treatment with something? Okay, so somebody became very upset with me yesterday that why was I so casual in saying that I have to do research on myocarditis. The reason is that I have been looking at the myocarditis and there is no more data available. So until I do research, until I find the data, until they release, the Pfizer and Israel release the data, I cannot make up things. So now, Texas, to your question, I'm going to make up things to respond, and this may not be the right one, but let me do it. So in our heart, this is actually a very common thing. For example, Coxsackie virus is a virus that causes inflammation of the heart. There are other viruses as well that cause inflammation of the heart. There are many viruses. So what happens is inflammation of the heart tissue. So let's say this tissue here is muscle, and then around the muscle, I'm going to make it in green just for color difference, is pericardium. Pericardium is sort of a shell. Oh, let me share my screen. I was going to do the same thing again today. Okay, so here. So this is a heart. The red one is the muscle, and the green one is the pericardium, or the covering of the heart. Now, there is information that pericarditis occurs. Pericarditis is different thing from myocarditis, right? So that is the inflammation of the pericardial membrane. Myocarditis is the inflammation of the muscle. Myocarditis, inflammation of the muscle. Now, viruses can cause this inflammation in a couple of mechanisms. There can be tons more, but two main mechanisms. One, direct infection of the muscle or pericardium. Usually pericardium is more infected with bacteria, but let's say virus as well. Viruses infect cardiac tissue as well, and they can cause myocarditis. So one way to look at this, the vax itself, is to say, can the vaccine itself cause the damage to the tissue, heart tissue? And vaccine is not a virus. It is not going to go into other cells, replicate in there, then cause damage and so on. So, and it is given in deltoid muscle. If it is a virus that is going to destroy a muscle of the heart, it is first going to destroy the deltoid tissue itself. So it is not possible that the deltoid tissue, so here is my deltoid where I got the second shot. Deltoid is fine, but the heart is destroyed. So I think vaccine particle itself is not to be blamed. Now, how can vaccine cause an issue which can cause an issue with the heart? And that is, once again, with the B cells, with the immune system. And this is what folks, it is difficult to discuss these things when people have not been following for the whole year or more time to understand lots of mechanisms. For example, somebody was arguing with me yesterday that if vaccine causes, let's say, a muscle ache, then it must be there to cause a muscle ache. What else would it be? So why are you saying vaccine does not go in the other tissues? So here is what happens. Vaccine went into the muscle. Immune system cells over there in the muscle started picking up the vaccine, and they started activating the B cell in the lymph nodes. Now B cells would start making antibodies, correct? This is one culprit possible. And then the macrophages and dendritic cell and the NK cells and neutrophils and T helper cells and some cytotoxic T cell, they would all start releasing inflammatory cytokines. So what we have now is a bunch of antibodies and cytokines. If these antibodies can bind to the heart tissue, and why would they bind to the heart tissue? That would be because, imagine if I have this vaccine's piece. So, you know, when the spike protein is picked up by our cell, it is shredded down into smaller pieces, and then those smaller pieces are shown. So imagine this whole thing is the vaccine. And if I take this cap off of it, and this is one epitope of the vaccine, one part of the vaccine, and it is being shown. Now, if this part accidentally looks very similar to pericardial tissue or cardiac tissue, then it is possible that these antibodies that are against this part will accidentally, incorrectly attack the cardiac tissue as well. Now, it is also possible on top of this, we have cytokines, inflammatory proteins, and these inflammatory proteins themselves can then enhance the effect. And that is a possibility for myocarditis or pericarditis with vaccine. Now, having said that, I actually do not know what is the reality. So until I have data from them, I do not know. Till that time, in the heart of my heart, I feel that there is an antibody reaction with the cardiac tissue. Now, your question, can someone anticipate myocarditis problems with second vax by intervention, pre-treatment with something? So now think about it. if you wanted to control the immune system, how would you control it? Antihistamines, anti-inflammatory, and in worst cases, steroids to suppress the immune system altogether. Okay, so so Denise says, totally inflammatory immune response. We have fibrin furin binding sites to take lutein to block it, like it was shown to do for dengue. Cool. Samina says, are you taking ivermectin prophylactically after vaccine? So this week I did not take it. I will take that. I didn't take it this week, not because it would play with the vaccine efficacy, but I didn't take it because I wanted to see what is the vaccine's own effect on me. And I didn't want ivermectin to kind of suppress it. I shouldn't use the word suppress it, meaning I didn't want the pain or some other inflammation that I do not realize because I was taking ivermectin, although taking ivermectin would not have been an issue. Aiden Aragon says, I don't think you answered if I can take ivermectin with vaccine and if it is generally safe together. I have answered that many, many times. One can take ivermectin with vaccine because their mechanisms are different. I have done a video which says, will ivermectin block a vaccine? If you watch that as well, I think 10-15 minutes, but generally it would not interfere with vaccine. And are they safe together? Yes. So I cannot give you advice, but generally from a mechanism point of view, yes, they are safe together. Bro4 says, question, my father is 60 years old. He had fever for 3 days, now day 8. He only have wet cough and his oxygen is 92 to 93. No other symptom. Is he safe? So once again, I cannot talk about a patient directly. In theory, patients who are at the 92 stage, they are at the cutoff from WHO's point of view to be hospitalized for oxygen. Most important thing, if I was managing my patient at this stage, other than talking with the doctor to say, should we take them to hospital or not, I would give them ivermectin the first thing. And then based on a few days, if there are a few days past, then I would give them steroids. I'll make sure their vitamin D is correct. I'll make sure that they have all those supplements that I've been talking about over the time. I'll make sure they have zinc. I'll make sure they have quercetin. That is how I would do. So is he safe? It really depends. If your question is, can his body handle it? I can't say that. You are seeing that the oxygen is dropping. Some people go to this level and then bounce back, but some people do not, and they continue to go down. So that is where it is actually a cutoff point for becoming serious. And this is also a point where prone positioning is very, very important. They should sleep with a prone position or face down, and then allow the back of their lungs to open up. But please make sure that you are very much in touch with your doctor. Talk about these things, and he should be observed like a hawk. My patients who are in this state, I call them every hour and see how are they doing and change things and give things. Scarlett, I just saw your question. I saw another question here from Steve. I credit Indian doctors as infectious diseases experts by experience. Should we be concerned that trouble in India is super virulent variant issue? So here is the problem for me to kind of provide a judgment. What I do not know is that even when they are good with the infectious or communicable diseases, SARS-CoV-2 is still a new kind of an issue. Plus, it is a viral kind of an issue. Plus, the pathologies it creates are out of this world. They have not been seen with other coronaviruses. Coronaviruses live in us all the time. We never even thought about them. If I pick up my microbiology books, coronaviruses get one paragraph of the treatment. I'm sure that now we can make books and books. Just from my talks, we can make books. So they are still doing better, but it is a big population. I don't think that all doctors know what is the right thing to do. I think the leadership, once again, they did much better than US, but there still is some gaps in there. Now, to your question that is it a super virulent virus? So far, the virulence that I've seen, the changes that I saw in the mutation, I don't see those changes to somehow impart its super virulence. The changes on the spike proteins that it has are very similar to South African or UK or Manaus. So I don't think it is at the super virulence level. Okay, so more questions. Let's see. Near the newer questions. So there is a question by Lady Tao. Lady Tao, I saw you after a long time. Can someone with acute heart failure take the vaccine? Question. So very important question. And I'm going to give you an example with the from Netherlands. So let me back up for a second. Acute heart failure, chronic heart failure. If the heart is relatively healthy and went through an acute heart failure because of some event and now has recovered, then heart is still possibly strong unless, let's say, if it was myocardial infarction, there is a global infarction, then the heart cannot even take care of the body. You put the pressure of a vaccine side effects on top of it, especially diarrhea, nausea, vomiting, those kind of things, it's not going to sustain. So it really depends what is the state of the heart, how much is the damage, how much is the failure. If it is just, let's say, hypertrophy of the heart, and it has been happening for a long time, but now it has become symptomatic and the patient has started taking medicines, such patient can actually with medicine sustain a vaccine as well, no problem. But if somebody had a heart attack and they have a global infarct, then taking a vaccine can really become bad for them. So I think it really depends upon cause of the failure, current condition of the heart, and can heart sustain if the vaccine caused diarrhea, for example. That's what happened in Netherlands, right? So the patients were given vaccine which ended up causing diarrhea, nausea, vomiting, and they could not sustain that. William Goff says, question, I've been taking I-theanine to decrease anxiety, I believe. This increases serotonin production. Would this be putting me at risk for severe COVID? I also started fluvoxamine. So what I do is with my patients, I usually ask them to stop everything so we can reset them and then start with the known things that we know, okay, fluvoxamine is going to do this, then add something else. So my request will be that if you're taking fluvoxamine, then stop the other one for a few days, see the results, and then titrate the doses if you need to. Yes, levothyroxine. Got it. Tony Clark says, what would cause someone not to have any side effects whatsoever after both jabs? So my friend Jan, my Swedish friend, he didn't have side effects after both jabs. So I had side effects. He got the vaccine a couple of days before me. So I was lying down and I was saying, hey, I have the side effects. And he was very worried that, hey, Mubin, why did I not have the side effects? Did vaccine not work on me? So no, it is not that. It is just that everybody's body is responding differently. There are, I think, 40 to 50% of the people who developed antibodies, but their body did not bother too much and did not create too many of the inflammatory cytokines. So Jan's question to me was, is my immune system too strong or too weak? And I said, neither. We do not know it is strong. We do not know it is weak. It is just antigen to antigen, our body responds differently. The optimal immune system usually produces less symptoms. So many people get viruses or infections in the cold winter time and they don't even get lots of symptoms and they become okay. For example, in my home, my wife has never gotten cold symptoms more than a few hours. And if I get cold, I get knocked down for 3 days. So her immune system works differently, but she has allergies. So that is an extra thing she has. So let's say more strong immune system. So the point is, not having symptoms is not an indication that the person doesn't have a good immune system. Now, a person who is immunodeficient, or a person whose cells, because of, let's say, diabetes, or because of age, or because of suppression by steroids or chemotherapies, if they have caused immunosuppression and then vaccine is given, they will not develop symptoms, or they would develop very less symptoms. So a healthy person not having too many symptoms should not worry. Westfield says, we are men. Same with my girlfriend, never had a cold. I'm down for 5 days. So that's exactly what happens. And women usually have stronger immune system, which also gives them more allergies compared to men because it reacts more to things. Okay, so Neil Bell says, do you take quercetin supplements, Dr. Bean? And if so, did you continue to take during and after vaccination? I am due second dose soon, unsure if I should take it or pause it. So one, yes, I take it. I have not taken anything in the last week. And I intentionally did that not to make sure that the efficacy is correct, but I wanted to see what will the vaccine do. I can at least do that with myself. I cannot do it to others. So yes, I take quercetin. Now the question, can quercetin somehow interfere with the vaccine? The answer is no. And let me maybe draw this one. Quercetin, hydroxy, they don't have, or ivermectin, they don't have that effect with the vaccine. So let's say here we are, and here is quercetin inserted in a cell's membrane to be a zinc ionophore. Quercetin has its own benefits as well, but let's say just this one. Now the vaccine arrives, vaccine gets into the cell. Vaccine does not need an RDRP to make copies of it, and zinc disrupts that. So vaccine will work fine. Now, if it was hydroxy instead of quercetin, it is possible that the acidity of the cell will reduce because that's what hydroxy does. And so that may slow down the cell in general, and that may reduce the efficacy or build up of the training for the vaccine, but the vaccine build up would still happen. The training would still happen. So this is how it works. So not worrying at all. Aditya Chipa says, my doctor has started deflazacort 6 milligram on day 3. Isn't it too early for steroid? My CRP is also negative. So I've seen many doctors starting it on the very first day. So imagine if somebody started having the symptoms. So here is, they got exposed. There is going to be some days that the virus is building up, but they don't have symptoms yet. Then comes a time that they have symptoms. Then from the symptoms, about 7 days, they have viral phase, correct? And I actually believe that this phase can become varying, because viral phase goes down when immune system counters it. And in some people, immune system builds up after a long number of days. In some people, it builds up fast. So this is the viral phase. The question is, should we give steroid during this phase? Now, first thing, if you are symptomatic here, you went to the doctor the next day because the day of the symptoms you thought it's nothing, or day after. So you're already in a day here. Now you went another 3 days. You're already 4 more days here. And then they started steroids. In my opinion, this is just an opinion, not an advice. It is fine. I have seen doctors starting it here. I haven't still found the courage to do it here. But I know doctors even in the US that start as a cocktail right from the beginning as soon as a patient comes. And that includes steroids, and that could be budesonide, just inhaler, or that could be systemic. So here we have the steroid. So people do it. The question only is that will the use of steroid reduce the clearance time of the virus? That is a question. This steroid usage is not big enough to cause just suppression of the immune system, and now it cannot even fight with the virus. It will fight with the virus. Possibly clearance can be increased time. But what I see is the doctors who are using it, this is just the same thing as ivermectin. Doctors using it saying it is useful, and those who don't, they say, no, 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 this is really bad. Similarly, you can put me in steroid camp, which says, no, 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 it is bad. But there are doctors who are using it. And when I talk with them, they say, you know what? Start steroid on the day one. Within 4 or 5 days, patient is fine. So would I be too worried? If I was the doctor, I would not start it yet. That's my being chicken about my patients. But I know lots of doctors that start it early. And they say it actually helps more. Okay. Barbara saying, Barbara, how is Lotus? Dr. Griffbean, good to see you. Are you doing okay? So Dr. Griffbean is here. Here he is. Hey, Chuck Becker. Hey, Dr. Griffbean. Random. How likely is for vaccine to have long-term side effects like 2 to 3 years after vaccination? Did that happen in the past? So it's a very charged question. The reason for that are multiple. One, folks who do not want to take vaccine, let's call them anti-vaxxer, although I feel just they don't want a vaccine. There are two types at least. One, those who probably saw somebody take vaccine in their family, in their own immediate family, saw some bad reaction and said vaccines are bad. And now they don't want anyone, including themselves, to have a vaccine. So somebody had an experience with it. And then there are those who have listened from others that vaccines do this. And in those others, if you would notice, majority of the people who are derailing others are doctors. For example, yesterday somebody left a comment that, hey, I would rather go listen to this geared guy and the other guy, and they're derailing them. And so the result of that is that they believe, so they have to figure out what to believe, right? So they believe that, hey, I'm going to go with Geert's message. And so they do not want to have vaccine. Now, these messages here, long-term side effect, is something that anti-vax folks say. And in general, if I do not know what is a good effect of this after 2 years, because I've not gone that far, then how do I know the bad effect of this after 2 years? So it is an unknown for both groups. So then to raise that flag and say, I know it is going to, for example, many people said that Mubin is now going to die. Rest in peace, Dr. Bean, and bye-bye, nice knowing you. There was a lot of comments. I may die. So they would be saying that, hey, look, we said it. But the thing is, we don't know. So long-term effects for this type of vaccine, messenger RNA, are not known. Long-term effects of adenovirus vaccines are known because these have been made for more than 10 years. Long-term effects of inactivated viruses are known for their adjuvants, but not known for the virus type itself. SARS-CoV-2 is a new thing. What would SARS-CoV-2 itself do to those it infects, or to those that it is given as inactivated? We do not know. So long-term side effects is something that cannot be said. So if you ask me, hey, 2 to 3 years later, what would happen? I don't know. Did this happen in the past? So now connect it back to those who have an experience. So somebody has an experience, let's say people saying children become autistic. Now that would be a dot to connect for someone to say, you know what, it happened in the past. For me, I'll tell you how I look at vaccines. And I will guarantee you that it's nothing more than that. And that is this. If we have a cell and there is a pathogen that arrives, so let's say this is a SARS-CoV-2 or this is some other pathogen, it is going to attack the cell, and the cell is going to, while it is being attacked and being killed, it is going to shred this pathogen and show it on its surface, and it is going to cause the immune system to be activated. we fail in protecting us or not, but immune system will put up a fight, and so immune system will become active. If we become successful, then in the future we can fight with this pathogen more easily. That is the basic idea of an infection, an immune system. In case of vaccines, we are talking about those infections that can kill or disable or cause severe issues, and those results are not good. So then giving a vaccine is really giving a tiny bit of infection. So now I'm using a very loose word. For example, the spike proteins are not tiny bit of infection, they're just part of the virus. So we're just giving a part of the virus, a very tiny part, and the same mechanism is going to occur. So why is a vaccine going to be something that we should be afraid of if it is nothing but a taste of the pathogen to us? I know that now there will be lots of comments and anti-vaxxers. So to folks who are anti-vaxxers, when you put a comment there, put something that is digestible, that is useful, that is understandable, that has some reference for it. Fake science is not useful. Science without reference is not useful. And just simply cursing is just totally not useful, because I just don't even look at that comment. Most of the time, if you're cursing, I just delete them. So this is what a vaccine is. Now the question is, will adjuvants cause an issue? And those adjuvant-related allergies or other such effects is something that needs to be considered. So this is how I look at a vaccine. Vaccine is nothing scary in this point of view. Okay, so let's see. What else do we have? Colin is here. How come South Dakota did so well without all the measures Fauci recommended? So, Colin, I'll have to look at this. I did not know that South Dakota did well without Fauci's recommendation. So, Colin, send me an email. You have my email. Send me an email with this question so I can research it. Okay, so there is regenitarianism. Do we have any precedent for messenger RNA vaccines for long-term effects? How can we make any assumption based upon prior attenuated or protein subunit vaccine when these vaccines are so different? Very correct. Very correct. And that is why I said that, hey, messenger RNA vaccines are newer things. And the older one, I talked about adenovirus, and then I talked about inactivated virus, and I said we know them. So I'll have to repeat my whole discussion once more. But if you just wanted to say, hey, how about this? I would say yes. We do not know. And so all we know is the trials, all we know is the doses given now, and what would happen tomorrow or day after or a year later or 2 years later, we'll have to figure this out. And this is why some folks come in and say, congratulations to be a lab rat. So that was said, or congratulations to be a willing participant in the experiment. Fine. But to your question, we don't know for the long-term usage. But so far, the trials have not shown anything extraordinary. And I did about a year ago a talk about Moderna. So if you can please go check that out. I had actually put together the concerns about Moderna vaccine and what could be the issues. I think this is one of the reasons that when people look at those videos, they think that I am an anti-vaxxer. And then they see I'm taking vaccines and they say, what the hell? I have been saying that I'll take a vaccine for the whole year. So I've never hidden this, and I would not hide it. Skyfrog says, I'm a guinea bean. I'm a guinea bean as well. So actually, anti-vaxxers should now love us more because we are the guinea beans. They can observe and say, yay, we know what is going on. Mama Beaver says, can DVT be side effect of the Moderna vaccine? So look, there is some political part and there is some realities in there as well. Deep vein thrombosis or clotting in the legs have been observed more with the adenovirus-based vaccines. That is the AstraZeneca, Johnson & Johnson, I'm sure with Sputnik as well, but we don't have any data. Oxford then came back. I did that study's review as well and said, well, if it is 1.5 persons per million for AstraZeneca, it is 1.4 persons per million for Moderna and Pfizer. So they came back and they said, we think it is the similar risk. I have been trying to figure out where did they get that data from, because at least in the US, the published data do not show that. So because of that, I do not know yet. And the trials do not say that as well. So if Oxford had not put that study out to muddy the water a little bit, I would have said no. But because they have put the study out, I cannot say that I know it does not do it, because it is a study which says, hey, we know it does it. So from that study's point of view, there is an equal risk. From the data I have seen so far, I have not seen that. Sanjeev Gupta says, what will happen if I've taken 2 different vaccines, brands of different types? Will it provide more efficacy? I know that data is not there. Excuse me. What is your take from scientific point of view? So very simple. I have talked about it before. Good question. So let's say we make our immune system here. Let's say all the immune system cells are collected in this one box, and that is our immune system. And we bring in one vaccine. Let's say we bring in Moderna. And we bring in a spike protein. And then what we do is we make shreds of this spike protein. We make pieces of this spike protein. And then we expose our immune system to say, hey, look at these pieces of spike protein. Check it out. We have something for you to look at. And the immune system says, okay, fine, I'm going to get trained, and it becomes trained. So let's say this is the first dose. Now let's say we decide to give a other dose from inactivated virus. That may be an Indian vaccine, that may be a Chinese vaccine, that may be some other vaccine. So now we have a dead body of the virus. And I know I'm going to get comments, viruses never are alive and they would never die. So just go with me here. So this is an inactivated virus. That means the RNAs are deactivated. So this virus cannot really produce any enzymes. It cannot replicate, but it has it's the whole body of the virus. So now we expose immune system to this. And again, to do this, once again, we are going to shred it. In that shredding, we will also have the spike proteins here. These are here, and these will also be shredded, and this would be re-exposure. Plus, there will be some more exposure. For example, there is N protein. N protein would be seen for the first time, and there will be shreds of those. An immune system would look at them for the first time, and it would need about 2 weeks to respond to them. But it would start responding to this immediately. Then, let's say matrix protein. So matrix protein is here. Let's make it this way. This is matrix protein. So that would be shredded as well. And now that is presented to the immune system as well. And the immune system would start responding to that. Immune system has not seen it before. So it is going to be, let me take the comment away just so that the whole screen can be seen. So let's say immune system has not seen this before, but still the immune system is going to start working on it. And that work would take 2 weeks. So that means some parts of the inactivated virus vaccine will trigger the immune system to start building up the immunity and proliferating and increasing the cell numbers and becoming a little more robust about it, or boost with the spike, and it would develop more immunity as well. So tomorrow when the actual virus comes in, immune system would be much more ready with the spike protein plus with the other proteins. Now let's say that instead of inactivated virus, we gave an adenovirus. So that is AstraZeneca and Johnson & Johnson and others. So adenovirus protein. So let's say here is the adenovirus that came in. Again, we know that adenovirus, there would be two classes of proteins produced. One is this class, and that would cause the immune system to start building up. The other class would be adenovirus itself, and the shredded pieces of the adenovirus, and that would be presented as well. An immune system would start responding to that as well. So now think about it with me. It doesn't matter what vaccine type was given first and then what was given second. Immune system will use that as a booster and would respond. Where is the problem then? The problem is this. See the RCT guys, the big study guys. I am that guy as well for these vaccines. I am not for the ivermectin because ivermectin has proved itself. So let's say ivermectin is just totally useless for SARS-CoV-2. Still, the safety is proven. I can take it better than the ivermectin, the Tylenol, with better outcomes in terms of safety. Vaccines, we don't know. So the big data guys says, big science guys say that, hey, and I say that too, hey, we do not know. We haven't done this data analysis that Moderna 1 dose, 2 dose, but now we are saying Moderna 1 and inactivated 2. We have never seen what would happen. And that is not provable that what would happen other than Mubin talking about that science here. But that science would not become a study, and so that is where the problem is. So similarly, if you give adenovirus and then you say, I'm going to give messenger RNA, that is where the problem is. The other problem is, I've discussed it many times, the adjuvant here is different, the adjuvant here is different. So let's say if somebody is allergic to polyethylene glycol, and we had given them adenovirus, and now we want to give them Moderna, we cannot give them Moderna because they're allergic to Moderna. So that is another. Or for example, let's say Johnson & Johnson, it is bad for women under the age of 50. So don't give it to them. Don't try to mix it with that. So there are those reasons. Then there are those ethical and moral discussions that, for example, there are some vaccines that are built in copies of the or clones of the fetal tissue, and some people don't want that. And so for such person, if we try to switch it and say, I'm going to give you a vaccine which is built in a tissue, let's say AstraZeneca, then they would say, why did you do that? So I think there are multiple facets for the mix and match thinking. And from a science point of view, it is fine. Dosage, type of vaccine, adjuvant type, these are the things to consider. Frozen. So mine cause says, which is the best vaccine to get for the least chance of adverse reactions? Pfizer, Moderna, J&J, that is the only thing I'm afraid about getting a vaccine. So mine cause, do me a favor. I have done a video. The title of that video is Comparing 3 Vaccines. And I think I've compared these 3 in there. Generally, I love J&J from this point of view that just 1 dose and we are good. But J&J is bad for women under the age of 50. So I would not want to give a woman this vaccine. Even when people keep crying that, hey, the chances are less. Even if there is one avoidable death, then as a doctor, we should do that. If we cannot avoid it, then our hands are tied. Here is an avoidable death. Don't give this vaccine to somebody who's under 40 or 50 and you're fine. Or if you're going to give it, then bring the paraphernalia to help them not develop clotting. And if they do develop, help them be safe from it. So that is J&J. Pfizer and Moderna, they both, I like them, but they cause allergic reactions with probably polyethylene glycol, although the paper that I studied today with all of us, they said we could not really figure out what was a component. They just knew Moderna causes allergic reaction. So the rate of allergic reactions are low as well, but there have been deaths with that too. And I think that the deaths there are also avoidable because the deaths occurred, the cases that I know, at the vaccine center. They gave them EpiPen. That did not help. They were now taking them to the hospital. It took time and they died on the way. That's not the way to do it. There should be more drugs. There should be better preparation. Maybe have a mobile ICU unit present with at least 1 bed on it. Anyways, I think too idealistically. So Pfizer, Moderna are kind of similar. I like Pfizer from one point of view, and that is that Israel has used Pfizer and kind of the whole population has used it. All age groups have used it. So the issue that came out from there was the cardiac issue in under 30. And 2 people died. One was a woman, one was a man. So that is, of course, a tragic situation. And there were, I think, 56 or 62 cases. So that means that Pfizer can have that for youngsters. Moderna, we do not have heard anything yet. And is that because we're sitting in the US and it is a US company and that's why we're not hearing it? Or is it because it doesn't have those things yet? Or is it because the studies have not just come out and they are in the process? So this is how to look at it. It depends upon your age. It depends upon your gender. It depends upon your previous allergies history. And then it depends upon what vaccine you would take. Okay, so Mary Angela says, how are Pfizer and Moderna vaccines different from mRNA vaccine, which were developed for SARS-MERS, which all failed due to the subjects all dying when encountering the wild-type virus? So I assure you, the second part of your comment is wrong. If people would die when they would be exposed to the wild type, Pfizer and Moderna have been given in hundreds of millions of doses now. You would see people dying all the time because the virus has not gone away. So that is wrong. Now, let me explain why they failed. And I hope that you have an open mind to understand it and then do your own research to find it as well, instead of just being all cap upset person. When the SARS-CoV-1 vaccine started being produced by Oxford in UK, before that the virus got contained, fortunate for the world that we didn't have SARS-CoV-2 like issue at that time. I would consider that to be a fortunate thing. And the further development of vaccine was useless. So they didn't do further development. This tail end of the sentence that this somehow caused deaths is wrong. And if you think it is correct, please send me, not from some nutcase blog, send me some study from Oxford who made the original SARS-CoV-1 vaccine platform, and I would love to read that and correct myself. Now, how are they different? The first part of your question. They are not different because they're both messenger RNA. But what could be different? Let's look at that together. Because there are differences, right? So here is the SARS-CoV. I hope that you are not a believer that the SARS-CoV has never been found and seen and sequenced, and that is just the whole thing is just a hoax. So I hope you believe this much, that the SARS-CoV is here, SARS-CoV-2, it is killing people. Just look at India. They are not all just making up a new thing. This is a new virus. And here is the spike protein. This is the genome for the spike protein. What they do is both Pfizer and Moderna picked up this genome, this genetic material for spike protein. And then they made it into a messenger RNA. That means they added a cap to this. They added a tail to this. They did some modification to RNA as well to give it some more durability. Otherwise, it would be destroyed before it can do a lot of help and train the immune system. Now, they both are supposed to make spike proteins as well, correct? So now if we look at this, we can say that here they are both the same. One difference is the adjuvants. And you can see the difference in adjuvant. For example, Moderna temperature need is different versus Pfizer's temperature need. And that need difference is because of the formulation of it and adjuvant, not because of the RNA genetics. One second. So adjuvant may cause different kind of reactions. And that means even when this is a messenger RNA vaccine, one may have a totally different kind of response in the body than the other one in terms of body's reaction to the formulatory substances. Now, let's go to the spike protein itself. Spike protein itself could be slightly different in both cases. And how is that different? And again, now I have a conjecture because I do not know this. Imagine if, let's say this is Moderna and let's say this is Pfizer. Imagine if Moderna picked up not the whole 100% of the RNA, but it took maybe 20% from here. It looks more than 20%, but go with me. This is 20%. And they just use that. So that means the spike protein that is being formed is something like, let's say, this structure, not the actual whole spike protein. And let's say Pfizer picked up this, and the spike protein that is formed is slightly more different. Although I feel that this conjecture of mine is incorrect because we want the whole spike protein to be shown to the immune system. We don't want pieces to be shown. But let's say their spike protein's presentation, the genetic code that they have is different. And because it is different, now they both invoke different kind of antibodies. Again, they are against the virus, but they're slightly different. And so now they both would behave differently as well, slightly different. Can they both neutralize? Yes, they tested it. That is what they trialed. They both saw. So their side effects may be different. Their dosage requirement may be different. Their duration between the doses may be different. And that is how to look at it. Okay, so let's continue. Doug seems stunned. What happened, Doug? So Kahina says, do you not get that it is about control, health passports? COVID is nothing and has been hyped up. Okay, so did you say wow to your own statement, or are you saying wow to me? So if you're saying wow to your statement, then add my wow as well. Wow. So no, I don't get it. And it is not this way. Okay. More RNA spells Moderna. Okay, thank you very much. Okay. So let's answer a few more questions and then we stop. If you have severe allergies to insect, spider bites, and sting, what would be the best vaccine to take? So all vaccines, in case of the allergies, should be given with care. But we know that messenger RNA-based vaccines have caused more allergic reactions. Others have done too. So there is at least a message out that, hey, if you are allergic, please make sure that you talk with your provider. So allergy intensities are different as well. It's not necessary that everyone who had an allergy will have an allergic reaction. Barbara Warren, nutcase blogs get so many people messed up. Yes, all the time. Rubies are red, nutcase blog. Yes. People send me the nutcase blogs all the time. And I go in there and it is just some weird statements which cannot stand on their feet. And then they have connected based on those incorrect assumptions that they think people would not research. And then they just created a house of cards and a straw man argument, which is just weird. And we cannot expect every non-medical person to go do graduation in medicine to then understand who is right and who is wrong. The medical professionals have created so much of mud that it seems like every human being has to now become a doctor to understand what the F are they doing. And that is the dishonesty at this time. And just to talk about, so maybe I am doing the same thing, right? So how do you know? All of my talks till to date have references in the description. All of my talks, and I showed the links before. In the beginning, I used to not have references, and then people started saying, hey, you may be lying. So I thought, why not just put the references there as well? So all of my talks, maybe initial 1 or 2 months, barring that, have references. Now, if I used a reference and misinterpreted it or incorrectly understood it, that would be a human mistake on my end and I would accept it. But I would not do a talk without just in the air. So Doug says, why does Chile have high vaccine numbers but still high cases? So this, I have to still do this discussion. I have to do this research that why are there some countries, for example, Seychelles is another example, which have good vaccine coverage and they still have cases. I sincerely need to look it up. Fish says, Dr. Bean, can you please make the Indian government aware of Ivermectin as a standard protocol? It could save the lives of hundreds of thousands. And there are so many folks from India who are working with me. I'm trying to work with FLCCC as well for this too. They are trying to do as well, and they get taken down. Their posts are taken down. So I guess that there is an effort which is continuing. I am part of that effort as well, but there is a resistance that is bigger. And there are two types of resistance. One type of resistance is doctors with the egos who think that whatever they know is sufficient and nothing more can be added to the knowledge they have and can be of any value. So these egotistic doctors who do not want to think about anything else are one reason. And let me put you in this situation for myself. I'm not egotistic, but I'm more scared. For steroid, for example, I talked about this question. I know so many doctors start steroid in the day one. I still don't do it. So some doctor can look at me and say, what's wrong with you? Because you know about one study, that is you're being snob or you're being stubborn. But that is where I am stuck. So similarly, there are doctors who are stuck that I don't think ivermectin will work. It is an anti-parasite. They also do not have seen those mechanisms that I have presented about 20,000 times. Then there are those folks who are actively creating disinformation. And those folks are big pharmas and the people with the money and the people who don't really care for what happens to people. They just care that, would I get some more money? And those folks have their own very powerful lobbies. I can assure you of this. Someone with money has always gotten more power than the crowds of sincere human beings. So there are people with money and they have power. And so a third group is those folks who are following these leaders who are misinforming. And these are the ones I say that they have to go do graduation in medicine to then understand who's right and who's wrong. And we can't expect everyone to go do graduation in medicine to know that. So I don't fault them. So when somebody challenges me here and says, you are wrong, spike proteins will be produced all the time from the cells and will become modified human beings. And that is what Kahil said, that silly statement she gave, and that we would now produce spike proteins forever. How do I fault the person who's saying it? So I have, in the beginning, I used to become upset about it, that why are they thinking this way? Then I have learned to just ignore it, that fine, this is just how it is. There is a crowd who's causing mud. So now going back to your question, I am doing this. FLCCC is doing this. And then the results are what these are. I think we are still breaking through this resistance, because at the end of the day, the people who are dying are human beings, and human beings are very resilient. They won't just, roll over and let this happen. And that's why we'll be fine. Mama Beaver says, Dr. Bean, I saw someone make an assumption that DVTs were common after the second dose just because of the severity of the side effects. So people were immobile. Can that be a factor? It is a factor, but developing a DVT within 2 days of immobility, unless somebody has tendency for clotting, is difficult. So for example, women clot more than in the legs. They clot more than men. Women in advanced ages with a little bit of obesity clot more than men. Women who have a special some venous issues, they clot more than men. So there are, if somebody has that propensity, for example, people can develop DVT just by sitting in a plane for 14 hours. But then we have to talk about their propensity. So yes, you're right, somebody can become immobile, and if in that process their legs are not properly moving or they're not walking around, it is possible that the DVT can start. Robin Huber says, how long after the second Pfizer shot can someone get side effects? Also, can double or blurred vision be a side effect? Friend 80 year is suffering this, MDs can't find anything. So yes, so side effects, I'm just going to draw it for you. So let's say this was dose 1. Dose 1 prepared the immune system. It kind of made it aware that, hey, an antigen of this type can appear. And we know that the preparation from dose 1 will start anywhere from 5 days to 17 days. And then immune system would make some memory cells, some active cells, and there would be some work. Some cells would be sleeping, some cells would be active. Then let's say a month later, 1 month or whatever, 30 days, 20 days later, we give second dose. Now the second dose has to go and kick these cells that were already active and say, ta-da, I'm back. And what these would do is they would say, fine, that means whatever we were doing, that is not sufficient. This thing is back. And they would increase their numbers. They would proliferate. Now this proliferation would take 24 to 48 hours. Those that were sleeping, they would wake up and they would start becoming active, and part of becoming active is to proliferate. Again, that would take 24 to 48 hours. Then these guys would stay active for some days. So when I started having my symptoms yesterday, that doesn't mean that my immune system is still not making antibodies and going after finding that vaccine. It is still doing it, and it would continue to do that for 2-3 months. But it is just that if it does not find that antigen, because the body has now cleared it up, then it's going to go and decline and go back to a baseline. So to your question now, how long after the second dose can a person continue to have symptoms? It would start from 24 to 48 hours, and it can, in some people, done within 1 or 2 days. Just look at me. In some people, it continues. My wife still has the joint pains. So for example, she said today that I was coming down upstairs some building, and she said I could not walk down the stairs because she had joint pains. So those started after Johnson & Johnson, and they are still there. So everybody would be different. Now, the second part of your question, that can blurry vision be part of it? Yes. Blurry vision can be of many, many reasons, but the blurry vision because of a vaccine that we know is that if there is any inflammation in the brain area, or for example, in case of Johnson & Johnson or AstraZeneca, we know that thrombosis or clotting can cause double vision, blurry vision. And that would be usually after the first dose, within 5 to 7 days and up to 17 doses. Usually if it didn't occur after the first dose, usually the chances are less to have to do this after the second dose, but from some studies, second dose can cause that as well. So I think what they should do is to look at D-dimers, CRPs, and then look at the bleeding time, clotting time, and just do the profile for thrombosis. That would be important. Otherwise, give anti-inflammatories, and that would start helping. So Michael says, Ivermectin and Fluvox really work for long COVID. Absolutely, they do. Okay, so Rico USA. Hey, Rico, saw you after some time. So thank you for the super chat. Cool Beans, please consider making a donation to the FSCCC. Also, please forward the 2 recent interviews with Corey and Big Science Disinformation to your friends. We need the truth to go out. I've been there. Thank you. There was one more super chat. if I can find it. What happens is these comments fade out after some time, and I cannot. So I'm at the top, and I can still not see it. Rizobit says, "Please, where is the video you made discussing vaccine effectiveness against variants? You went over the medical article saying vaccinated people are high risk of catching COVID variants." I remember what you're talking about. Isn't that the Israel study which showed that Pfizer vaccine, fully vaccinated, would catch more South African variant? But that was 1 week after. So I think the title of the video is High Breakthrough Rate. So if you look for breakthrough rate, you would see that. Although I corrected it afterwards, not corrected, the author said after 1 week we saw that, after 2 weeks we saw never any variant infecting these people. So I didn't even know why did they want to do that, but they did that. Arjun Som says, "My family and I have been staying in our home, India. No one in and out. All packages sanitized with Clorox and vegetables washed. Reports of people staying home yet getting COVID. How safe are we?" Look, this is the same thing that eventually you are going to be contacting outside to get foods and packaging and those things. So you are relatively more safe than those who are going out, unfortunately. And I'm not blaming those who are going out. There are needs for people to go out. You're relatively more safe. But everyone in my team who's been from India, they have had it. So I have all of them except one family, one team member, and their family still does not have it. But everyone else had it. And interestingly, even then there are older age people, for example, their parents, they all actually came back okay. The only difference is that I had said to my team members that they should all have ivermectin on weekly basis for their families. So maybe that made a difference. So Arjun, for you, the most important thing is that in addition to being safe and staying at home, are you taking any prophylaxis as well? If not, then I would strongly recommend to take prophylaxis and take it at a higher dose prophylaxis. And that would be good. Mr. J says, my super chat was at 6:40, your time zone. So Mr. J, can you put that question again? Because I can only see 7:40 p.m. and onwards. This commenting system removes comments and adds comments. So ask me the question again. My apologies for the. Okay, Nina Patel. No, doctor. Me and sis had already infected, landed in eye hospital. Neither had vax, were not developed. Then Vorina causes red eyes, corona, inflammation at back, were given eye steroids. Got it. Aditya says, is steam inhalation useful in COVID? FSCC says about essential oils. So look, two ways to look at it. Very important. Because there are some videos of mine that are attractant for insults. So my video on steam is one of them. In the beginning of the pandemic, a nursing friend of mine called me and said, Mubin, you would not believe people are using, the hair dryers at higher, higher value, and they are trying to blow into their nose and mouth if they feel that they were exposed to someone, and in that process they are burning their mucosal membranes. Then I started hearing such news as well, that people are trying to get steam to kill the virus inside the cells. And I did a video to say steam is not useful to kill a virus inside a cell because the temperature, so let me just very quickly draw this. Because the temperature of the steam and the temperature needed to kill the virus is more than the temperature needed to kill the cell. So steam is going to do nothing but to kill the whole cell. That attracts insults even till to date. And a majority of them are from India, because in India, in Pakistan, using steam inhalations is a very common process. So taking steam to break down the mucus and to clear the airways is a good thing. It's not bad. It is very, very valuable. I use it too. But taking hot waters or hot steams or blowing air in the mouth or nose is incorrect. So just be careful with that. Otherwise, steam is good. So let's see if Mr. J has put his question here. Here, Mr. J. Question: risk or benefit of dexamethasone once COVID positive but feeling healthy, just mild congestion? So depends upon the number of days. So I just admitted that I have a chicken behavior here, that I don't like to do it in the early. But what I've seen is doctors using even outpatient injectable dexamethasone 4 or 5 days after, and it really works like magic. So I think that 4 or 5 days later in the disease, taking steroids is useful. So feeling healthy and mild congestion, generally, I would not have started it in the beginning, but I would have done I would probably give oral instead of injectable steroids near 5-6 days time. Arnold says, can vaccinated people still take ivermectin? Yes. And I have a video about that as well. And I've discussed why it is okay, actually. Oh man, it is 8 o'clock. So time to break fast as well. If you are okay, let us praying for India. Absolutely. Let us stop for today. Today is Friday. I would see you all again on Monday. Stay safe and happy and healthy. Please like, subscribe, and share. And there are 3 links in the description. If you would like to support this work, then if you don't want to use PayPal, you can use Buy Me a Coffee. Or if you are okay, Patreon is great as well. And if you wanted to just support in general, then there is a link for that as well. So with this, thank you very much. And stay safe and happy and healthy over the weekend. I'll see you on Monday.